So Julie Wooten and my son was Max. He died actually. He died on the 1st of March, 1999. So it's 15 years tomorrow, which is quite apt, really. Foolishly, I decided to set up a support group. The information, he was diagnosed with DiGeorge syndrome. The information about DiGeorge syndrome was fairly poor at that time, and the cardiac liaison team thought it would be a really good idea to set it up. It wasn't. That's what I've been doing ever since. I'm also involved with the Children's Heart Federation. I'm chair of trustees for that. And I'm a trustee for Cardiovascular Care Partnership, which is the patient arm of the British Cardiovascular Society. So I had to give up the day job, obviously. 22q deletion. Oh, and by the way, it seems quite a mumsy thing to do, call a charity after yourself, but we started off as the DiGeorge syndrome support group, but it also covers velocardiofacial syndrome and the 22q11.2 deletion syndrome. So we thought those three all together with support group at the end of it wasn't terribly catchy, and we'd use this as a fundraising banner, and people remembered it, so that's why we used it. The genetics is now becoming more commonly used as 22q deletion. Unfortunately, still no more clarity on that, because now they're diagnosing duplications as well. But it's not actually a rare disorder. It's at least 1 in 1,800 of the population, possibly the most commonly undiagnosed condition that there is. But most people still haven't heard of it. In line with that, with my work with the Children's Heart Federation, I've got Irwin up the back there from Heartbeat NI. Congenital heart disease is 1 in 135 of the population. The talks earlier this morning, there still isn't a registry for congenital heart disease, let alone any of the rare disorders. So it's a nice thing, and it feels like, I was talking to somebody at lunchtime, it feels like we're at the bottom of K2 looking up, and we just got to get the crampons going and get up there. One of our other trustees at Children's Heart Federation is grown up with congenital heart disease, and he reckons that the cheapest kind of patient there is obviously, you're talking about treatments and cares, very, very expensive. Well, the cheapest option, of course, is to just let them die. And if you don't diagnose them, then you don't have to treat them either. So one of the simplest tests that there is pulse oximetry. Put the clamp on the finger at birth, 30 seconds, clip, unclip. That's all it is. It's not invasive, it's cheap, it's a 300 quid piece of machinery. It would pick up respiratory disease, circulatory disease, and the cyanotic congenital heart disease. And how many hospitals don't do it? And how many children still go home and collapse at X number of weeks or months and years undiagnosed? So, that's my little rant over with. And yeah, the geneticists, I'll wait for you all to decide about the duplications and deletions. What do we all do as charities? And this is what we all do, isn't it? We do the fundraising, do the muddy challenges. We've always got our begging bowls out, but without the money you can't do the jobs. And the jobs that we do are provide the information. We've just finished a national consensus document for 22q deletion. We've got 60 documents, thank you, Anne. To actually agree care pathways. And I actually think there's a little bit of a difference between treatment and care. We've all come across doctors and nurses who don't actually care. They can write a prescription and they'll do the consultation. But do they really care? Do they care if your child's in pain and weeping? I don't know. Do they care if the treatment, the care doesn't work? Well, that's another one as well. We get our families together. That top picture's there at the W5. We get them doing all sorts of stupid things, archery, cookery lessons, crossbows, big sharp knives. It's always a good one with children with learning difficulties. And we no coordination and attention deficit. What? But we haven't lost anyone yet, I'd just like to say. And everybody gets so much out of it, and the kids love it as well, because the parents are there talking, all getting together, and the kids, possibly the first times in their life that they meet somebody with the same sort of condition. So, it's all good fun, really. This is just a few. I just sort of went through my stationery box and got some of the logos of some of the organisations that we interact with and try and engage with and work with. Obviously, the international network is really important to try and maintain our links with all the people that are doing the top research. We're just recently setting up a 22Q Society, which is an international academic society, to get all the professors and the scientists, you know, your basic scientists, your basic clinicians, to get together to come up with all of their research documents in one little portal so that the patients can get the best out of it. And 22q deletion is incredibly variable. So as you can see there, I've got 22q Ireland on there, which is with Anne, and we were really pleased when Anne came to a couple of our conferences, and we weren't really looking after people in Ireland terribly well with the differences in their healthcare and all of that sort of stuff. And the logo that I haven't got there is the new kid on the block, which is Gillian, and really looking forward to collaborating with her to make sure that all of the people in Northern Ireland get access to top quality information through the information standard, which was painful to get through. But it means that you're going to get the best information out there. So the team, the 22Q team, thank you very much.
Oh, there I am.
Have you only got one?
Yeah, I've only the one. I'm just going to talk. That's myself and my daughter Anya, who's now 31. She was diagnosed when she was 15. I got to one of those international conferences when she was 22, and I was quite stunned, would be a very good word for it, to know what we both have been trying to deal with for those for 22 years, actually, coincidentally, 22. The theme for today is joining together for better care. You've heard Julie there, she's done most of the work for me. Parents and patient groups, we've been joining together. Oh man, have we been joining together for the longest time. We had to. We know what it's like because the physical health, not just the physical health, the emotional and psychological well-being of our children depends on us joining together. Before the groups, before I helped set up the group in the Republic, the Max Appeal, when Anya was diagnosed, I was given the diagnosis and the Max Appeal name and sayonara Anne. They did a few basic checks on Anya. They were satisfied that she didn't have this and she didn't have that, and sent me on my way. So Max Appeal took care of the Irish as best they could, and then we decided to set up the group. We're 7 years old, I think, this year, and we have taken part in, I think we're on our 7th research project. Like Julie, we don't get government funding, we fundraise. Most of our research, though, is psychosocial research. We're the people who know what it's like to live with the syndrome. All the patients in here will know what I'm talking about, all the parents will know. Wonderful researchers, wonderful doctors, wonderful clinicians, but we know what it's like. We are the ones that watch our children suffer. And we're the ones that have to help them. So joining together is really, really, but it's old hat to us. We've done it, and we continue to do it. We do it on the international level, I've seen. We do it on a national level because when I helped set up the 22Q group, I knew immediately that we wouldn't get very far on our own. Our voice is too small, it's too lone. So I affiliated us with the Genetic and Rare Disorders Organisation. I now work part-time for them. It's given me a broader platform. I've met many people with many different disorders. Our issues are all the same. We're all dealing with the same issues: medical, education, and social. So I think it's about 6 months ago, Gillian, was it? I got a message on Facebook. Us patients, we do a lot of work on Facebook. It's a very easy way for us to interact and for us to connect. And Gillian sent me a message on the Facebook page. She said, Anne, would you mind? She said, I'd like to set up a group. Now, we have about a dozen families, or we had in our, but we still have them in our group in the Republic. But Gillian asked me, would I mind if she set up the Northern Ireland 22 group? And I went, yay, another one. So I don't know how many we have internationally. We've dozens of them, dozens of 22. We're a great model, I think. We share information. Julie developed this, the consensus document. I got in touch with her. I said, Julie, can we have some of them? Of course you can, she said, and she posted me a box. That's what we do. We share the research, we share our stories, we share our successes, we share our failures, and that's it. We join together. So it's very much in keeping, I think, that the three of us are here today just to show you what can happen when patients and parents come together. So thank you.
Well, my name is Gillian. My daughter Lucia is 4. She'll be 5 in May. And it's only really been a year since she got her diagnosis with 22q. At the time of her diagnosis, she'd had a lot of different symptoms, different issues, and it all came together at her diagnosis. When we went to the hospital, they did blood tests, and when I was signing the consent form, had a little look down and seen that they'd marked a wee check against 22q. And I just, as you do, go home and straight on Google and Googled really what it was. And when I Googled the images for 22q.11 or 11.2 deletion syndrome, we got pictures back of children, and it blew my mind because there were children who could have been an actual clone of my daughter. They looked like her. It was like she had twins throughout the world. It was just, I couldn't wrap my head around it. It was my daughter, my DNA, my part of me, and there was people across the world who looked like her. And to have that sense of belonging in uncertainty, and that we weren't alone in our diagnosis. Even though at that point these children, the girls in specific, they lived in America, and that really gave me a good surge then to find out locally what was available to us. Obviously, when we went back for our results and we found out Lucy had 22q, I was all, so no. I seen the pictures already now. But through Facebook now, I had Lucia when I was 29, and I do think that if I would have had her even 10 years ago, I just wouldn't be where I am now. Even with primarily our support is on Facebook, and I just would not have had that network that I have now with Anne and with Julie and with the other families in Northern Ireland. This year, obviously, it's past. It's been a big whirlwind. Lucia gets a lot of initial tests to find out if there's any other quite common symptoms that she has within her body. Within the medical genre, I suppose, sometimes we have had the opinion that a diagnosis isn't as important as treating the symptoms. And I'm sure anybody here who has family members, or if you are part of that medical world, you will realise within yourself that that's just not the case. You can't actively and properly treat symptoms if you don't know what the underlying cause is for a lifetime of care. I've read that a worried mother does better research than the FBI, and I would attest that that is the case. Personally, through international pages such as the Dempster Family Foundation, based in America, I first read the list of symptoms, which is over 180, from heart problems to breathing problems, feeding problems. The list is endless. Not every child will have every symptom, which makes 22q maybe the hardest to diagnose. But I myself and with my husband have diagnosed Lucia with some very serious conditions, taken it to the GP and got her referrals, where she has been then diagnosed with craniosynostosis and a curve of the spine that hadn't been detected before, but wouldn't have happened if there wasn't this international and local service of other 22Q supports out there. So through that, through the knowledge of the consensus document and through all of these other things, it spurred me on within our little local Northern Ireland that is. I wanted to know how many more families are here, how many more families are living with this, how many more families are dealing with this on a day-to-day basis, and what can we do for each other. So when it's 2 o'clock in the morning and you're speaking via Facebook to another mum and talking about the stuff, including surgeries that they might happen to our children and her son has, where they maybe have to saw their skull to repair a fused bone, that's what joining together is. It's speaking to someone who is feeling what we're feeling and understands the broader aspects of a diagnosis. I was so naive when I thought, yes, an answer to our problems that Lucia maybe has or her issues. And I just assumed that was it, that was just an answer. But little did I know that there was a million questions then for the future. And we wouldn't be doing what we're doing unless we're joining together with the other people out there who can provide that support that keeps you going. And it might sound selfless running a support group, but it's not, because it enables me and my family to use Lucia's 22Q journey to actually mean something and to make a difference in Northern Ireland. And that's it.